Hi everyone, we are now going into the first tough chapter of the semester, which is chapter 20 about the heart. As I have mentioned before, it's a tough chapter, but yet super interesting about how your heart is able to do all that it's capable of doing. So let's get started. First of all, we will need to have some basic knowledge of the direction that blood runs in circulation and the blood vessels that are involved. We'll talk more about blood vessels in detail, but just now it's a gloss over these basic stuff so we know what we're talking about when we're referring to the heart. So there are two main circuits of the body that blood have to travel through. One is called the pulmonary circuit, and the other one is called the systemic circuit. The name itself tells you where the blood travels to. Pulmonary usually has to do with the lungs. So the pulmonary circuit is for blood to travel between the heart and the lungs. For the systemic circuit, the system part of it tells you that it is for blood traveling between the heart and the rest of your body, which means all your other organ systems and tissues around the entire body. And you have to know the route that blood will take and when does the blood gets oxygenated or deoxygenated. So I'm going to go through that process with you right now. So for pulmonary circuit, you are starting at the right ventricle. Okay, so here's the right ventricle right here, okay? And you are carrying oxygen poor blood, which means deoxygenated blood, from the right ventricle into the pulmonary artery, which is that blue portion right here I've just drawn through. And then it goes to the lungs, of course, either your right pulmonary artery or your left pulmonary artery into your left or right lungs. And then when it travels through the capillaries of the lungs, which surrounds those alveoli we talked about, they will carry oxygen-rich blood, which is then becomes oxygenated blood back through. It's going to make a loop here from the blue part of the capillaries of the lungs into the red portion of the capillary of the lungs, which represents that oxygenation and no oxygenation. And it goes right back through here. And that is, it's probably hard to see with red. I'm going to do green, okay? So here's right ventricle going through pulmonary trunk into pulmonary artery into your lungs capillary, coming out of your your oxygenated lung capillary, and then flowing back into the left part of the lungs through the pulmonary veins. Okay, now don't worry about how small this is because I am going to re-emphasize this whole flow in a bit when we get to later on in the chapter. This is just a preliminary introduction. Okay, so you get into the pulmonary veins, which then enters back into the left portion of the heart through the left atrium. Okay, so pulmonary circuit begins at the right ventricle and ends at the left atrium, okay? Which is why this is going from the heart to the lungs, okay? And then systemic circuits then starts at the left ventricle, which is now oxygen-rich blood that has just came in from the lungs. And then those blood will be pumped into your systemic arteries, of course, going through first your aorta, which is up here. Okay, this is your aorta right here, and then goes to all the different red arteries that you're seeing throughout the entire body. Okay, so these are what's called the systemic arteries, meaning that these are arteries that lead to all peripheral portions of your body, including the brain, the head, okay, within the arms and within the lower limbs. And what happens after that is after delivery to tissues, it drops off those oxygen towards those peripheral tissue. And what the blood then will pick up is the oxygen poor blood, because now you just dropped off oxygen. You picked up carbon dioxide, but those carbon dioxide have to go back to the lungs. So then those blood will then travel via your systemic veins, which is all the blue parts, the blue lines here throughout the entire body, and it will all drain back into either through the superior vena cava or the inferior vena cava this way, okay? And then they will drain into the right atrium of the heart, okay? So systemic circuit begins at left ventricle and it ends at right atrium before going back to enter into the right ventricle to start the pulmonary circuit all over again. Okay, so it keeps cycling between the pulmonary circuit, which the purpose of the pulmonary circuit is to pick up oxygen from the lungs. Systemic circuit then is to deliver oxygen and pick up carbon dioxide back to the lungs, okay? So systemic circuit is traveling from heart to the whole body, okay? Systems of the body, okay? All right. So there are 4 main types of blood vessels. We have arteries, which are named for for carrying blood away from the heart. So A for away. Veins are those signifying the blood that's returning blood to the heart. Okay, so don't just think that artery always is dealing with oxygenated or deoxygenated blood. There are exceptional cases within the pulmonary circuit and also within the pulmonary artery and pulmonary vein and the fetal circulation, where arteries can also carry deoxygenated blood. So arteries and veins are not characterized by whether they're carrying oxygen or not, but more so by the direction of blood that they're carrying. Either they're carrying towards the heart, which should be named veins, and then those that carry blood away from the heart is called artery. Okay, and then you have the great vessels, which is the big vessels of the body. That's why they're called the great vessels, because they're large. They're either large artery, the largest one, and the vein, which the largest artery of the entire body is your aorta. Okay, and that's why we have that part of the body that can withstand the highest pressure of blood being pumped from the heart towards the rest of the body. And then the largest vein, of course, would be your inferior and superior vena cava, coming in and collecting blood from either your upper portions of the body or lower portions of the body. And lastly, you have capillaries. So capillaries are those microscopically thin wall vessels. And I kind of talked about it last chapter when I was talking about how tiny they can be. They can be as tiny as a hair strand. Okay, so they are small because they need to get to every one of those little cells within the body. Okay, those, there are big organs, small organs. There are large chunks of tissues. There are small chunks of tissue. So there are capillaries that can get to those smaller places as well, and that's why they need to be small. But they will interconnect those places for delivering nutrients or dissolved gases, waste exchange between blood and the surrounding tissues. Okay, there are main exchange vessels. Okay, so the tough part of blood vessels and circulation chapter, which is the next one, is capillary exchange. Okay, there will be different pressures that's involved, okay, that allows things to migrate out of the capillary in certain direction, and then for things to come back towards the capillary and back towards the heart. And we'll talk about capillary and details of capillary exchange when we get to chapter 21. All right, so those are the 4 main types of blood vessels right here. Okay, so now on to the heart. Let's get to the structural anatomy of the heart first, which is really the easiest part of this chapter, is the structural anatomy part. The heart is an organ, as we all know, about the size of one of our fists. Now, this is talking about on average of a normal individuals. It really depends on the healthy state of the person's heart to determine whether, there's what size of their heart is. I have seen hearts from pathology labs at Baylor Hospital that were as big as my face. Of course, those hearts are actually taken from patients that have passed away from heart diseases. But, that's how big those heart muscles can get if they have to work harder for pumping the blood to everywhere of the body. Maybe there's blockage somewhere or something, along those lines. We'll talk about coronary artery disease as the last thing of this chapter. But now, on average, usually an adult-sized, healthy heart should be about the size of a fist. So the heart is divided into 4 muscular chambers, serving the main function of pumping blood from one place to another, of course. You have the right atrium, which is right here. This is actually the posterior view of the heart. So make sure when you're looking at models, what students get mixed up with, is not hard to label them, but what they can get easily mixed up with is right versus left. So make sure whenever you're looking at anterior view of the heart, you're looking at some patient's heart, which means your right is not the patient's right. Your right is the patient's left, and your left is the patient's right, But, I've purposely put in posterior view here so that it aligns with your right and left. But when you're looking at the heart from the anterior view, make sure you reverse the right and left part, and it becomes critical because the flow of blood has to go from one way into another, you can't reverse it and say the right atrium or the right ventricle goes into the systemic circuit. That doesn't happen. All right, so this small little blue part right here is the right atrium, which receives blood from your systemic circuit and passes it on to the right ventricle. So blood goes in from your superior vena cava or your inferior vena cava, travels into the right atrium, into the right ventricle. And then the right ventricle, of course, will pump it into the lungs through the pulmonary circuit. Then it comes back into the left atrium here, and which collects, like I said, collects blood from the pulmonary circuit and then empty the blood into the left ventricle. The left ventricle will then pump that oxygenated blood into the systemic circuit. Again, you'll get the hang of it because I keep repeating this whole process over and over again as we go through all the different parts of the heart, All right, so those are the 4 main chambers of the heart. Right atrium, left atrium, right ventricle, left ventricle. And you can't get confused with atrium versus ventricle because atrium sits on top or superiorly to the heart, to the ventricle, which means it goes from in alphabetical order. A comes before V, so A has to be on top, V is on the bottom. The other easy way to remember ventricle is the ventricle is actually the cavity within the ventricle is kind of in that V shape. So that's how, these two things will never, make me mistaken or confused about which part of the heart is an atrium, which part of the heart is a ventricle. All right. And when the heart beats, the atria will always contract first, and then the ventricles, You can't have all 4 chambers pumping at the same time. And I'll talk about why that is when we get to the later physiology part of the heart. But it always has to be where the atrium contracts and pumps first, and then both of the ventricle will contract. Left and right atrium will contract together. Left and right ventricle can contract together. But atrium and ventricle cannot contract at the same time. It's a very critical part of cardiac cycle. All right. So the heart is basically, of course, located within the thoracic cavity, as we have learned from last semester, the very first chapter on. It is near to the interior of your chest wall, directly posterior to the bone sternum of your thorax part of the skeleton. The base of the heart, which is, now don't mistake base and apex, which is why I asked you to label apex on the lab exercise for the heart, is because the base does not mean the bottom of the heart. Okay, the base of the heart means that's the superior portion of the heart here. This is referred as to the base. This is the apex. Okay, so the base of the heart is actually posterior to the sternum, because the sternum is right here. And the thing is, the heart is not entirely symmetrical inside our thoracic cavity. It's kind of angled towards one side of the chest. So that's why only the base of the heart is directly posterior to your sternum. The apex of the heart is actually the inferior tip of the heart that kind of angles toward the left side of the body. Okay. And so the heart sits within the mediastinum. We already talked about the position of the mediastinum last semester when we were going over those serous membrane of the lungs, the heart, and the, those cavities, peritoneal cavities, all that stuff. So the heart actually sits within the interior mediastinum, while the posterior mediastinum right here is what contains your great vessel. Your base of the heart is where your aorta comes out of the heart, and then it actually does an arch-like manner, okay, and dips downwards into the posterior mediastinum, okay. Same with the vena cavas, and this is just the esophagus that you're seeing here. But the heart itself, the organ, is sitting in the interior part of the mediastinum. We also talked about this back in the beginning of last semester about serous membrane. The heart is protected from rubbing against each other or, other tissues of the body when it beats via that, is protected from, when the heart beats, it rubs against other tissues. So it's protected from that rubbing action via a double layer membrane called the pericardium, which is a serous membrane. Remember, visceral versus parietal. Okay, so parietal pericardium is referring to the layer that is on the exterior side. Okay, so if you look at the heart right here, again, let me use the green instead. Okay, so this layer right here on the outside would be the parietal layer of the pericardium, and then the layer that's directly attached to the heart there is the visceral pericardium. Okay, visceral pericardium and parietal pericardium. Okay, so visceral pericardium is the layer that is directly attached to the heart, and for our heart chapter purposes, this is also known as the epicardium layer of the heart. Is the same thing, because we're going to define the layers of the heart as epicardium, myocardium, and endocardium. So epicardium is actually the same thing as the visceral layer of the pericardium. Okay, which is why I put this in parentheses there. Okay, all right. So between the double layer serous membrane is a small space called the pericardial cavity, where it is filled with pericardial fluid that we talked about last semester. Remember this picture, that fist driving into the water balloon I was talking about. And it is mainly for the purpose of reducing friction that can occur between the heart tissue and other tissue that surrounds it. And remember last semester I kind of used that sweet potato in a Ziploc bag demonstration filled with, the Ziploc bag was filled with water, and I said that's kind of like your pericardial fluid, and the sweet potato is like the heart, where it's surrounded by this layer, this double membrane layer, so that when it pumps, it provides that lubrication purposes. Okay, and I use that sweet potato thing as a demonstration and illustration of that concept. So I'm not going to repeat that here. Pericarditis is also something I talked about last semester. Is a condition where the pericardium itself is infected with pathogens. And inflamed pericardial surfaces will rub against each other, which produces, supposedly on the stethoscope, a scratching sound. Okay, they say it's kind of like leathery surfaces rubbing against each other. That's why they call it a friction rub that can be heard through the microscope. And I was curious myself to how this really sounds like. So I was able to find a pretty good video that includes an example of the scratching sound of pericarditis. And I will include that video in the lab exercise for the EKG and cardiophysiology lab. Okay, so be sure to listen to that compared to normal heart sound within the lab itself. Okay, click on the link and then the link should take you to the video in the lab exercise PowerPoint. All right. The trouble with pericarditis is that it commonly results in increased production of pericardial fluid within the pericardium. And imagine this is supposed to be this thin layer right here that is supposed to allow the capacity of the heart to expand. Okay, this space is supposed to be not very big. Okay, now imagine if there's lots of fluid being generated within the pericardium, or in the case of a lot of movies and dramas like to put it, is where something starts bleeding within the heart and then the blood starts seeping into the pericardial cavity. And that's also what happens. And that's when they go in there with the needle and try to remove blood from the pericardium. So that's that whole drama within those medical dramas that usually they always have that case. Okay. So what happens is here's the heart. Okay. And here's that layer pericardium that surrounds. But now I'm drawing it super large because that entire part is now filled with fluid. Okay, so instead of a thin layer of fluid, that whole layer have that increased production of serous fluid or pericardial fluid. So now it ends up pushing on the heart muscle, the whole entire organ itself, and now the heart has no room to beat. Okay, even though the increase in size of each heartbeat is not a lot, but you can't squeeze down on the heart like as if you're putting both of your hands around the heart and squeezing it from being able to pump. Okay, and that's basically what happens with increase of pericardial fluid when you have pericarditis. And this condition is known as the cardiac tamponade, okay, which basically says you're restricting the movement of the heart and hence the heart can't pump. You're squeezing on it and the heart can't efficiently pump out the blood. You're not delivering oxygen to the rest of the body, and that's why those dramas would then show the patient with those machines, okay, and they show that the blood pressure is dropping very, very low, oxygen level is dropping very, very low until they can remove that fluid from the pericardial cavity, and then they can allow the heart to pump normally again, and suddenly you see the machines going all normal again. The blood pressure climbs back up, the oxygen level climbs back up. Okay, so cardiac tamponade, that's what it is the blockage of, or squeezing down, if you will. If you want to think of it that way, squeezing down the heart so the heart can't efficiently pump to produce blood pressure and also push blood through the systemic circuit or the pulmonary circuit. Okay. All right, so the joke I usually make in class about cardiac tamponade is that the second word kind of sounds like tampon, and tampons are for females anyway, for plugging up the vaginal area so blood doesn't leak out. So you can think of this kind of like plugging up the heart, okay? So the heart ends up not being able to move in that pumping action as efficiently as it should be able to, okay? So that's one way you can remember as a joke, okay? So that, not that it's tampon or anything, but that's how I forever can remember what cardiac tamponade refers to, okay? That restriction of movement of the heart. All right, so now we'll zoom into the detailed structures of the heart. Most students seem to miss where the atria is located because of how small they are. When we actually dissect pig hearts in the lab, the atria almost looks like little ear flaps that can be easily missed where it is. Okay, they usually think the ventricle is the atria and somewhere else is the ventricle. So that's also why they sometimes refer the atrium to being an auricle, because it kind of looks like a flap of lumpy ear like this that's sitting on top of the heart. And for the pig heart, somehow the atria is even smaller compared to the ventricle. They're almost like this big size of the heart, and then you have these two little flaps up here that's called the ventricle of the pig heart. Okay, that's why students always ends up missing it when we do this dissection of the pig heart in lab. Okay, but for the humans it's not as pronounced, but still, it's a pretty small little flap of lumpy tissues. So even though they look small, but they are made up of much thinner layer of still muscles, cardiac muscles, compared to ventricles, but they are still highly expandable and able to fill with blood and push the blood into the ventricles. They're just not as thick and big, is because all they have to do is push the blood into the ventricle. That's all they have to do. So it doesn't take a lot of work to do that, and we'll understand why that's the case when we get to the cardiac cycle part of the physiology of the cardiac cycle part of the lecture, because technically speaking, we're not pushing a lot of volume from the atrium into the ventricle. All right, so the coronary sulcus, remember we already learned from last semester that the lateral sulcus of the brain, sulcus usually refers to the shallow indentation on the tissue or organ surface. That's why last semester I said, hey, this is a good word to remember. This is a good term to remember, because we're going to probably see this more than once throughout the entire A&P course. And sulcus is one of those that refers to some sort of shallow indentation. Fissures are deeper indentations. Okay, so this of the heart, we have some sulcus. Okay, so this being coronary sulcus is where the coronary part means something to do with being on the heart itself. Okay, just like how cardiac refers to heart, coronary also usually refers to something to do with the heart. And this, and then the sulcus part, usually means that shallow indentation. So it's got to be the shallow indentation within the heart itself. Okay, and it turns out to be a groove that goes along the border between the atrium and the ventricle. So within right here, there's a deep groove that allows blood vessels, or specifically coronary blood vessels, to go through that area. Okay, so coronary blood vessels themselves is for the purpose of delivering blood to the heart muscles, because not just the heart is pumping blood for everyone else in the body, okay, for all the other organs, but the heart itself, all those muscles is constantly pumping for you every minute of the day, every second of the day. They require oxygen too. So that's why you need coronary blood vessels on the heart for delivery of oxygen to the heart muscles themselves. And we'll talk about the specific of these vessels in a bit. What are the names? Where do they go? Etc. Okay. So similarly, the anterior and posterior interventricular sulcus is those that allow for these blood vessels to go through. And again, I'll talk about the names of these blood vessels. Again, the name here tells you where this groove or sulcus is located at. Okay, anterior means front of the heart. Okay, so this is the anterior view of the heart. And interventricular, inter means between, ventricles. So this is on the front side of the heart between the ventricles, and it is a groove between the ventricles. So that means it has to be this one right here, which is a groove for blood vessels to go through on the heart. And same thing for posterior. This is that posterior interventricular sulcus. Okay, This is again the posterior view, and you should be able to recognize anterior versus posterior view of the heart from the heart models in lab exercises. Okay, so because some things are located only on the anterior side, some things are only located on the posterior side. Okay, and these sulcus area are usually filled with adipose tissue, and also where those fat cells are serving as protection and cushioning of the arteries and veins that go through them. Okay, so that's why you see a lot of yellow blobs here and yellow blobs here that represents those fat cells that surrounds those blood vessels to protect them and insulate them. All right, and inside of the heart, there are tougher tissues that makes up what's called the cardiac skeleton. It's not actual skeleton, it's not bones, it's not osteons. There's no osteon within that area. There's no dense versus spongy bones. It is just called skeleton because it's a tougher tissue that's located within the heart. It is actually made up of 4 dense bands of tough elastic tissues. Notice that it's not bone tissue, just elastic tissues that encircles the heart valves. So this one right here, this one right here, and this one right here. So the circle here, here, and here are your cardiac skeleton that make sure the bases of the pulmonary trunk and the aorta are stabilized in their particular position. Kind of like how sometimes you see metal rings that are installed to support water hoses. You can literally, I think the aorta looks a lot like the water hose, like really big garden water hose. And sometimes people have to support the opening or the connection of the water hose with the water faucet with those metal rings. And that's what cardiac skeleton is kind of doing, is to support that connection between the aorta and the ventricles, especially because the heart is pushing with a lot of pressure through these great vessels that we want to make sure they don't, they're well supported and they don't collapse on each other. That's the main thing, is we never want a blood vessel to collapse. Just like how we never want a water hose to be stepped on. Okay, if someone accidentally stepped on part of your water hose, you're like, oh, I thought I turned on the faucet. No, how come there's no water coming out? Well, someone is stepping somewhere along the way on your garden hose. Okay, same thing with blood vessels. You never want the blood vessel wall to collapse on each other, analogous to someone stepping on the water hose and then no blood goes through. Okay, so that's why for these important areas of blood delivery, they have these cardiac skeleton to make sure they stay open. All right, and just like we have 3 layers of muscle and nervous tissue, epimysium, endomysium, perimysium, things like that. We have something similar, same prefix scheme, similar anyway, for the 3 layers of the heart. Okay, the epicardium, like I was saying, is the outermost layer of the heart that heart wherever heart tissue begins with. Okay, so we're not talking about this layer right here. That's not the pericardium. Okay, epicardium. It is actually the parietal layer of the pericardium is what this layer is. This layer right here, this whitish layer, is what the epicardium is, okay, which is what I was talking about, the same as visceral layer of the pericardium. Okay, it is mainly made up of mesothelium and areolar tissue. We kind of talked about that again last semester in the tissues chapter. Second, in the middle, is the myocardium layer, which is all the muscular layer of the heart that surrounds both atria and ventricles. And this, compared to all the other 2 layers, is the thickest layer of the 3. The way they are designed to shape also has to do with how the muscles contract. The myocardium that makes up or winds around the atria forms this figure eight shape around the great vessels of the heart. They wind around it, okay, so to allow them to able to squeeze those atrial chambers. Okay, so it kind of squeeze this way and then kind of squeeze this way, and both of them squeeze at the same time when the muscles contract to squeeze the blood into the ventricle. The myocardium of the ventricle is form somewhat of a spiral-like manner that twists towards the apex, because that's the direction of contraction will move. It goes from up here and then goes to down here, and then we'll learn about that has to do with the way that electrical impulses are conducted down the length of the heart as well. So remember those depolarization and repolarization stuff? You can't forget those from last semester. We're going to talk about it again because it has to do with how cardiac muscles can contract. Okay. And then the most inner layer of the heart is called the endocardium, which is pretty thin. It's just a simple squamous epithelial layer with some underlying areolar tissue that covers the heart's inner surfaces. Okay, so if I point to an inner surface of the heart and ask you what layer is there, then the only thing I can be referring to is the endocardium, which is this little layer right here. Okay. All right, though, that's pretty simple. So the two muscular partition that separates the two atria and two ventricles, because we do have 4 chambers, but how are they separated from each other? They're actually separated by other muscles, and we give them names. So the two atria is separated by the interatrial septum. And then the two ventricles are separated by the interventricular septum. So we can't really see interatrial septum in this picture here, but if we were to able to angle our way and look from this way into the heart, that there is that muscle behind the aorta here that separates the right atrium from the left atrium. And interventricular septum we can definitely see a lot better, which is right here. Okay. This right here is the interventricular septum that separates the left ventricle from the right ventricle. Okay, and again, these names should not be too tough to remember because, as the name tells you, where it is. Okay, it's either between the atrial part, okay, which is between the atria, or between the ventricles. That's why they're called interatrial, interventricle. And the septum word really means some kind of layer that separates two spaces. That's what septum usually refers to. All right, so let's talk about the detailed structure as we follow blood coming in from the systemic circuit toward the right atrium. That's how the book has sort of formatted the order of the structures that we're talking about. We're following the journey of blood cells, red blood cells, coming back from the systemic circuit towards the right atrium. So deoxygenated blood after delivery to your peripheral systemic tissues and organs will drain back into the heart via 2 great vessels. You have your superior vena cava and your inferior vena cava. Okay, so this is the superior vena cava. This is the inferior vena cava. The superior vena cava will drain blood from the head, neck, and upper limbs around the chest area, whereas the inferior vena cava here will collect blood from your trunk of the body, the rest of the trunk anyway, viscera, okay, which are the other organs in your abdominal area, and then your lower limbs as well. And when the right atria contracts, it will push blood through a valve that sits between the right atria and the right ventricle. So this is the right atria right here, right atria, right ventricle. Okay, you see these flaps here, these white flaps. Okay, so those flaps form what's called the tricuspid valve. Okay, this is the tricuspid valve. And its name has to do with the amount of flaps the valve is made up of. If you look at the structure of these heart valve, they're kind of made up of some thin but yet tough pieces of connective tissues. Okay, they're tough, even though they're thin. But this is the valve we'll live with for the rest of our lives until they start deteriorating, and some patients have to go through valve exchange and valve transplant. Okay, but from birth all the way till when we're 89 years old, these are the valve flaps that we're going to live with. Um, and if you look at the structure of these heart valves, okay, they form these fibrous flaps, and we call them cups, okay? And these cups can snap together very tightly so that fluid will not be allowed to flow between these two chambers here once the flaps closes, okay? Unless it opens, blood will not flow between these two chambers, okay? Or if there was a malformation of these particular structures, which usually is congenital or deterioration as we age, that's when we will compromise the function of these three cups, and blood can actually leak back and forth between the atrium, from the ventricle back into the atria, and that's bad news. We'll talk about that in a bit. But the purpose of the tricuspid valve is the three flaps will close on each other so that it forms that tight seal between the right atrium and the right ventricle. So this particular valve on the right side, like I said, is called the tricuspid valve because it contains three cups, okay, three little flaps, okay. And these three flaps will swing open and shut according to muscular contraction of the heart that I'll talk about when we get to the cardiac cycle. Now, the unique thing about tricuspid and on the other side here, the bicuspid valve. Okay, so this side is called the bicuspid valve because it only has two cups on the left side. Okay, so this is another distinguishing feature how we can tell whether we're looking at the right ventricle versus the left ventricle is by how many cups these valves have. Okay, the right side always have tricuspid, 3 cups. The left side always have 2 cups. Okay, and the unique thing about these two valves, is that they only open in one direction. Thankfully, it only allows blood to flow from the atria into the ventricle, whether it be right atria into right ventricle or left atria into left ventricle. It's always in that one direction. It should not allow blood to flow backwards from the ventricles back into the atria. Okay, atrium. And the accessory structure that ensures this, no reversing back into the atria is called the chordae tendineae. Okay, chordae tendineae. And what these chordae tendineae are, they are basically fibers that attach the cups of the valve to special muscles called papillary muscles. So this right here, all these little finger-like looking thing are your papillary muscle. These fibers here are your chordae tendineae. So same thing on this figure here. You see these finger-like structures, this here or this here. These are the papillary muscles. These fibers that's attached to your valves, either your tricuspid or your bicuspid valve, these are the chordae tendineae. Okay. And how this works is kind of like what we learn about tympanic tensor muscle for the tympanic membrane when we talked about hearing, how, it stiffens the tympanic membrane when there's loud noises to prevent it from vibrating too much, okay? This is somewhat similar. It's a string that pulls on the cups to make sure that when blood is pushing against it, it does not reverse the cups back into the atrium, okay? Because what's going to happen when the ventricle pumps, it creates a lot of pressure, okay? When this squeezes down, blood is going to try to go this way, okay? When blood tries to go this way, it will first close these cups, okay? But the pressure, technically speaking, can actually push the cups so the cups reverse into the atria, allowing blood to flow into the atria. And we never want that to happen. So that's why we have these strings to tie them down, okay? And anchor them down and make sure they don't reverse back into the atria, okay? So what happens is when ventricles contract, the papillary muscles here will also contract. Okay, we'll talk about how that electrical signal as it travels through the ventricle, it also goes into another small little part of the heart that leads the contraction impulse to the papillary muscles as well, so that when ventricle contracts, papillary muscles here also contract, pulls on these chordae tendineae, which will prevent the valves from reversing back into the atria. It can actually make a severe impact on the efficiency of the heart if blood was to leak backwards into the atria. And for me, it's easier to remember this word for what it does. The chordae tendineae, it kind of sounds like cord and tendons, okay? Which sounds kind of like fiber strings that pulls on things, okay? Because we learned from last semester that tendons is pulling those muscles. So it's kind of like this pulling on those cups of the valves, okay? So it's not hard to remember chordae tendineae, okay? All right, so far we have followed the blood from the vena cava, whether superior or inferior, into the right atrium, okay? So from here into the right atrium, and then we just went through the tricuspid valve into the right ventricle here, okay? So blood will then travel from the right ventricle through the pulmonary valve right here. This is the pulmonary valve into this part of the great vessel, which is pulmonary trunk, okay? So pulmonary valve leads into pulmonary trunk, okay? And trunk kind of sounds like tree, okay? So it's got to be it can't be a valve. It's some blood vessel, okay? So pulmonary valve leads into pulmonary trunk. When the right ventricle contracts, blood will then flow towards the pulmonary trunk through the pulmonary valve into onwards of the pulmonary circuit of the cardiovascular system. Now, the superior portion of the right ventricle here actually tapers down, and we give it a name. This tapering down area is called the conus arteriosus. It's kind of, as the name suggests, conus, meaning it's some kind of cone shape, okay? And it's leading into a blood vessel, and that's why they call it arteriosus. And it's going away from the heart, leading away from the heart. That's why they call it arteriosus. So this little part right here is what referred to as the conus arteriosus. And this is where blood have to go through another set of valves, which is, we call it the semilunar valves. And this one specifically is the pulmonary valve. This here actually is kind of behind the pulmonary trunk. The heart is a very hard organ to visualize without a model. So you kind of have to imagine and play around with rotating the heart in your mind, okay? And also from different views on the Practice Anatomy Lab, okay? On your Master A&P website, okay? So in back of this pulmonary trunk is the pulmonary valve, where blood will enter from the left ventricle into the aorta, okay? So these two valves right here as a whole is called semilunar valve, okay? So the specific one that opens toward the pulmonary trunk is the pulmonary valve, and why it's called pulmonary is because it will lead blood into the lungs. Now, for both of these semilunar valves, they are made up of 3 cups, okay? That's why it says 3 semilunar cups, and they do not need chordae tendineae because the great vessels here won't contract with a lot of pressure, okay? There's no heart muscles here for them to contract the blood backwards, so that's why we don't need chordae tendineae to pull them, make sure they don't reverse. Technically speaking, they will not reverse because there's not a lot of pressure coming from those great vessels to push blood back into the ventricles, okay? All right, so the deoxygenated blood then will arrive at the pulmonary trunk, which is usually the start of your pulmonary circuit, will then follow and go through with the rest of it, either through your left pulmonary artery, or right pulmonary artery. Okay, so that's why I said left or right pulmonary arteries. Okay, so even though it's blue color, don't go by color to know whether it's called artery or vein, because this is one of the exceptional places in the body where blue is actually talking about arteries. Okay, because it is moving blood away from the heart, not towards the heart. So that's why we call these here the pulmonary arteries, okay? All right, so they do, most arteries do carry oxygenated blood, but in this case, we're actually carrying deoxygenated blood from the right ventricle through the pulmonary valve into the pulmonary trunk and then into the pulmonary artery, okay? And it's moving blood away from the heart into the lungs, okay? The blue of it signifies that it is carrying deoxygenated blood into the lungs to carry oxygen. So you have to remember the names of arteries and veins based on which way the blood flows. If it's away from the heart, it's arteries. Away for arteries. If it's moving blood back towards the heart, it is the veins. And why we have both left and right pulmonary arteries is because they will have to carry blood toward both left and right side of the lungs. We do have two sides of the lungs, okay? So that's why they have it kind of branches out into this format there, okay? So once the blood has traveled through the lung capillaries that surrounds the alveoli that I talked about last chapter, blood now carries a lot of oxygen from the lungs and become oxygenated, okay? And they will travel back toward the left atrium. This is the left atrium right here. And these are called pulmonary veins because now these are vessels leading back towards the heart, okay? So these left and right pulmonary vein will then carry blood back towards the left atrium, okay? Again, they're called veins because we're taking blood back towards the heart, and there are no valves between these pulmonary arteries or veins and the lungs. There's no valves within these blood vessels right here, okay? Just like how there's no valves that sits between the vena cava and the right atrium, okay? There are only 4 valves in the heart, and these two right here is what we just talked about, the tricuspid and bicuspid, and then the pulmonary valve versus the aortic valve, okay? So now we will continue our journey following direction of blood flow. Blood flows from the lungs through the pulmonary veins and now arrive at the left atrium, okay? The left atrium will then contract and pump blood through the bicuspid valve, okay? Or sometimes they also call this the mitral valve, okay? So either way you remember, it's fine. I just like to remember this valve as the bicuspid valve because it tells me how many cups it should have, which is helpful information. Because only the left side of the heart has 2 cups, okay? So this is what I mean by looking at the anterior view of the heart. This is actually the left side of the heart. This is the right side of the heart, okay? So the name of the cups helps me distinguish which valve goes whether it's, those between the right atrium, right ventricle, which should be the 3 cups, tricuspid, versus that between the left atrium and the left ventricle, which should be bicuspid, 2 cups, having 2 cups. All right, and when the left ventricle contracts, the oxygenated blood will then travel through that, aortic valve behind the pulmonary trunk that we can't see here, okay, and enter into the great vessel called the aorta, okay. The structural makeup of the aortic valve is also very much similar to the pulmonary valve, where it has these 3 cups just like that, and there's no chordae tendineae for the aortic valve as well. So the aorta here is actually divided into 3 sections. You have the ascending aorta because blood goes upwards, okay? So that's why this portion is called the ascending aorta. This little curve area that has these 3 things sticking out that you will have to learn in lab, that this is the brachiocephalic trunk, this is the left common carotid artery, and this is the left subclavian artery. And I usually like to tell my students to remember the order of these 3 arteries is B, C, S, okay? BCS. That's how you remember the order of these arteries coming out of the aortic arch. So this curve area section of the aorta is called the aortic arch, and then the rest of the way that goes down back towards the posterior part of the body is the descending aorta. Okay, so these three sections of the aorta is divided here. Okay. All right. Other than the characteristic of the valves, there's another thing that is different between the left and right ventricles. The myocardium layer of the left ventricle is actually a lot thicker than the layer of right ventricles. So this is the left ventricle here. This is the right ventricle. You see how thick this muscular layer is? And why that's the case is because the left ventricle have to exert a lot more pressure, and we'll talk about how much of that pressure it is, and we will know the exact value it has to exert. But that high pressure has to be what's pushing the blood from your left ventricle into the systemic circuit. Okay, it's relying on this muscle right here to push with that high pressure through the aorta to the rest of the body. Okay, so on the other hand, the right ventricle only has to push the blood towards the lungs, okay, which is a lot closer in location. You're just back here around the heart versus you have to push it through towards the whole systemic circuit. Okay, so that's the main reason why you have a lot thicker muscle generated or that surrounds your left ventricle, due to the fact that you have to push with a lot more pressure towards the systemic circuit. Okay, so this actually leads to an interesting concept, is that because the muscles of the left ventricle is so thick and powerful, when it contracts, it actually ends up pushing into the right ventricle space as well. In a sense, it's assisting with its contraction. Okay, so this is how the heart looks like if we take a cross-section, transverse section of the heart. You see this open space of the left ventricle and the open space of the right ventricle. When these muscles of the left ventricle squeezes down inwards, okay, you see how this muscle layer kind of squeezes down on the left ventricle. It also kind of push into that right ventricular space right here. Okay, so that's why when these muscles contract, it also pushes the blood this way, assisting with the blood to flow from the right ventricle into the pulmonary circuit. Okay, so technically speaking, if an individual has a blockage in the heart's blood vessels specifically, that lead to cardiac muscles being damaged due to lack of oxygen, it actually results in a better prognosis if the damaged side is on the right ventricle versus the left ventricle. I mean, at least if it is the right ventricle muscles that was damaged and can't pump as well, the left ventricle muscles can make up for some of it, maybe not entirely 100%, but you can survive a little bit longer if your right ventricle was the one that was damaged. For example, if you were stranded on an island or on a natural trail for hours, if it was on the right ventricle, you might last a little longer out there without someone discovering that you're dying from a heart attack. Now, if it was on the left ventricle, however, if the left ventricle muscles are damaged, there's nothing else to assist with its pumping, and you're saying that you can't get blood efficiently into your entire body, which means all the organs in your peripheral parts of your body starts deteriorating, starts dying, and all the organs start shutting down. Okay, so that's why the left ventricle is a very critical part of the heart. Okay, and hence why it's so thick. So both tricuspid and bicuspid valve, like I was saying, we group them into something called the AV valve, okay? Atrioventricular valve. And that's because they kind of sit between your atrium and your ventricle, okay? This is your atrium, this is your ventricle, and these valves sits between them. That's why we call them atrioventricular valve, or for short known as AV valve. and because they prevent the backflow of blood from the ventricles back into the atria. Okay, now when the ventricles is relaxed, which is this case right here, you see how the ventricle is nice and plumpy with a lot of space in the middle. The chordae tendineae should be loose, okay, because papillary muscles was not signal for contraction yet. Papillary muscles is supposed to contract at the same time that ventricles are contracting. So everything is relaxed. So blood is just filling into the ventricles from the atria, and then the AV valves gives no resistance whatsoever. Okay, so blood will just go right in through from the atria to the ventricle. When the ventricles contract, however, you see the space now becomes very tiny. Okay, and these muscles have now pushed inwards, okay, towards the center of the heart. So this pressure that's generated by the ventricle will push blood towards this. If this is the left side, it would be the bicuspid valve. Note that this also happens on the same way on the right side of the heart. It's just that this picture only shows the left side of the heart to make it more simple. Okay, so when the ventricles contract, blood is pushed this way and that way. Okay, but the blood can't go anywhere here, because when blood goes this way, okay, when blood tries to go this way, what it ends up doing is it would just push the AV valve shut. Okay, it really shuts and closes up those valves. Blood should not be leaking into the atrium, and then hence they will come back and then goes in towards wherever there's an opening, which would be your aortic valve going into the aorta. All right, so when those ventricles contract, the papillary muscle here also contracts, which then pulls on these chordae tendineae, and it prevents those AV valve cups from reversing back into the atria. So all this nicely oxygenated blood just coming from the lungs will not be floating backwards into the atria. All of them will then efficiently go towards the aorta, towards the rest of the systemic circuit. Okay? All right. But if the chordae tendineae were cut by accident, okay, let's say it was a really bad surgery or something, or because they deteriorate over time, or if the papillary muscles were damaged themselves within right here, then the backflow of blood into atria can occur, because you no longer have this cord here, if it was cut, to pull on the cups. And if the papillary muscles isn't contracting, all of this will be relaxed stuff. Then this flap can easily go like this instead, okay, and reverse into the atria. Then blood will just be allowed to flow right in back into the atria, and we refer to this as regurgitation of the blood. Okay, all right. So the other set of valves, which are the pulmonary and aortic valve, as I've said, they're known as your semilunar valves. And they're there to prevent backflow of blood from the pulmonary trunk or the aorta back into the right or left ventricle, respectively. Okay, and no muscular braces, like I was saying, is needed. There's no papillary muscles, there's no chordae tendineae, because the blood arterial walls themselves, they do not contract, and the cups positions are already stabilized by the cardiac skeleton around that area. And on top of that, the opening is a lot smaller compared to the opening between the atria and the ventricle. All right. So when the semilunar valves close, okay, you see these three right here, okay? So those are the three cups of the semilunar valve. This is the aortic valve, this is the pulmonary valve, okay? So then when they close, they kind of support each other like a little tripod, and this is actually an actual image of an aortic valve that we can see from a real person, okay? So you see how it comes together nicely to create that tight seal between the three cups of the semilunar valves, okay? And when valves are open like this, okay, technically speaking, because these are just little flaps of connective tissue, these flaps can actually get stuck, okay, onto the wall of the aorta or the pulmonary trunk. So there are already designs intrinsically, anatomy-wise, that will prevent the cups from sticking to the wall of the aorta by what's called these aortic sinuses, okay? Let's see if there's here, aortic sinus. Okay, so this is that valve, aortic valve opening up, and you see that there is a space between the opening of that flap or cups, okay, and the wall of the aorta. Between that is the aortic sinus that makes sure that valve right there, that cups, that does not end up sticking to the wall and it won't flap back down, okay, because then we will be in trouble too. If these cups end up sticking to the side of the aorta, whatever blood that's supposed to push from the ventricle into the aorta and then to the rest of the systemic circuit is just going to travel and go right back downwards, okay? And now your blood again is not going anywhere, and then again your cardiovascular system fails, okay? So it is very important that these valves are doing what they're supposed to be doing in order to ensure blood always flows in that one direction, okay? Or else the cardiovascular system fails and you're not delivering oxygen efficiently to other parts of the body. So, and hence a condition related to the normal structure of these valves is called valvular heart disease, or for short is known as VHD. This can be due to deterioration of the valve function as we're getting older, or it can be due to congenital malformation, or inflammation of the heart can also lead to valves start changing in their shape, and inflammation of the heart is called carditis, which is usually caused by rheumatic fever that is common with streptococcal bacteria infection, specifically often in children. Okay, so that's why fever cannot be taken lightly when it happens in children, just in case it was a streptococcal bacteria infection that can lead to that inflammatory response. And if that inflammation happens to spread towards the heart and the heart becomes inflamed, technically speaking, it can also potentially cause these valves, which is very critical, as we've just immensely talked about, in the way that they're folded and closing next to each other, that they have to be fitting perfectly. And if they aren't fitting perfectly, you're going to have regurgitation and blood will not be efficiently pushed towards their designated area, and your cardiac output will then decrease. The person is constantly, weak, sleepy, etc., because they're not getting enough oxygen. Okay. And eventually, of course, it will lead to more problems when you're not delivering enough blood to everywhere else in the body. And so now we're going to get into how the heart itself can receive blood vessels and hence, blood flow and hence oxygen from its coronary circulation. Okay, so we had pulmonary circulation, systemic circulation. Those are just pushing blood either towards the lungs or pushing blood towards the rest of the body. Coronary function has to do with circulation of the heart itself. Like I said, the heart itself needs oxygen flow too. Okay, so hence these coronary arteries are providing the heart with oxygen, and there will be cardiac veins that will drain deoxygenated blood from the cardiac muscles back towards the inferior and superior vena cava. Okay, so the coronary arteries originate at the base of the ascending aorta. So this is the ascending aorta. You see this little blood vessel coming out. Okay, so that is the start of the right or the coronary arteries. Okay, and this is the start of the other coronary artery. One is go towards the right side of the heart, and one goes around the left side of the heart. The right coronary artery follows that coronary sulcus we were just talking about, and actually leads around the heart and continues backwards this way into the posterior interventricular artery. So it goes from here in the aorta, in around the coronary sulcus, and then back towards the posterior portion of the heart, down the interventricular artery, and run towards the apex of the heart to supply all these muscle cells, cardiac muscle cells, with oxygen and nutrients. Okay. The left coronary artery, which then starts here, goes around the left atria, okay, curves around there, around that coronary sulcus, around that area, and then it will branch into the interior interventricular artery. Okay, the rest of it swings around the pulmonary trunk and runs along the interior interventricular sulcus. So either it goes around this way or it goes down this way. We won't talk about the circumflex artery much, okay, but this one is what goes down into the interior portion of the heart. Okay, all right. And then veins, because after you distributed all that oxygen and nutrients toward all these muscles around the heart, you're gonna have to collect them back so that it can go back towards your inferior vena cava to go into the right atrium, right ventricle, back into the lungs to pick up more oxygen. Okay, so all those blood that is now has carbon dioxide because it just dropped off its oxygen and it collected all the carbon dioxide from the muscular fibers is going to go towards the great cardiac vein. So all this blood is going to go inwards into the great cardiac vein, upwards, okay, which then goes along the surface of the entire ventricle into the interventricular sulcus, reach the level of atria, curves around left side of the heart back into what the region called coronary sinus. Okay, so coronary sinus. So this great cardiac vein collect blood from the anterior portion of the heart, goes around backwards towards the back into this main drainage area called coronary sinus, and then the middle cardiac vein will then collect blood from the posterior portions of the heart into the coronary sinus as well, and all the blood, deoxygenated blood, will now travels back in towards your right atrium, okay, and then drops the blood off there so that those deoxygenated blood can then go into your right ventricles, into the pulmonary trunk, into the pulmonary circuit to pick up oxygen and deliver it right back out here from towards the coronary artery again. Okay, so that's the whole circulation flow of the heart itself. Okay. So now we're going to get into the physiology part of the heart. I guess let's take a break here. We'll end part 1 here. It's been an hour, a little bit over an hour. We'll end part 1 here, and don't be surprised that we'll have lots of multiple parts for this chapter. I would say this is the longest chapter of the semester. I think blood vessels is about the same too. So that's why I separated into 2 lecture days. Okay, so don't be surprised if we have more than 2 parts for this chapter. Okay, all right, so let's stop part 1.